I'm going to discuss with you now maxillary nerve, which is a second division of trigeminal. So when I talk about maxillary nerve or V2, I like to remind you that this nerve is purely sensory nerve. Okay, remember V1 and V2 are sensory. V3, which is mandibular, is mixed nerve. Okay, what is the course of this nerve and what are the branches and the clinical application of this nerve? If we start from trigeminal ganglion, which is located in the middle cranial fossa, exactly here at the apex of petrous bone. If you look here carefully, you will see here is the anterior surface of petrous bone. You see this fingerprint or impression. This is the impression of trigeminal ganglion. So trigeminal ganglion is located here at the apex of petrous temporal bone in the middle cranial fossa. So maxillary nerve come from trigeminal ganglion, travel through foramen rotundum, this foramen rotundum here. So when you come to foramen rotundum, it's going through foramen rotundum, it go to next to trigopalatine fossa. Okay? So here is the trigeminal ganglion, V2, exit middle cranial fossa through foramen rotundum. So this is foramen rotundum. Trigeminal ganglion. V2. What is next? Coming through foramen rotundum, go to trigopalatine fossa. So this area here is going to be trigopalatine fossa. Trigopalatine fossa. Okay. Then anterior to the trigopalatine fossa, this infraorbital fissure or inferior orbital fissure, the nerve come first lateral through the trigomaxillary fissure, then go through the inferior orbital fissure to the floor of the orbit. So it shifts laterally through the trigomaxillary fissure, and here it appears in the infratemporal fossa because this area is the infratemporal fossa. Then continue through the inferior orbital fissure, through the orbit. Inside the floor of the orbit, is traveling through the floor. This called infraorbital groove, then infraorbital canal, then appear in the face through the infraorbital foramen. So this is groove, canal, foramen. Okay, infraorbital groove, infraorbital canal, infraorbital foramen. Okay, so basically it looks like that this infraorbital nerve is a continuation of V2. So simply, if I come to cranial cavity, here you can see foramen rotundum. Once it come out through foramen rotundum, where it go again is coming to trigopalatine fossa. If I travel through this foramen, I am inside the trigopalatine fossa. Okay, and then if I push this forward, you will see it going through the infraorbital fissure, and it appear here through the orbit. So basically I'm starting from here, from middle cranial fossa, foramen rotundum, going to trigopalatine fossa. Here is the trigopalatine fossa, if you remember. Here. This is the trigopalatine fossa. Okay. Then through the inferior orbital fissure is coming to the orbit, traveling through the orbit in the infraorbital groove inside here. You see this groove, then infraorbital canal, then infraorbital foramen, So this is the course of maxillary nerve. Okay. What are branches of the maxillary nerve? Now we know the course. Okay. Cranial cavity, foramen rotundum, trigopalatine fossa, infratemporal fossa, inferior orbital fissure, infraorbital groove, infraorbital canal, infraorbital foramen. What are branches? You will see that maxillary nerve might give some meningeal branches to the meningeal covering of brain in the middle cranial fossa. Then here in the trigopalatine fossa, it gives two ganglionic branches which connected to the sphenopalatine ganglion. Two ganglionic branches connected to the sphenopalatine ganglion. Okay. Then is going to give posterior superior alveolar PSA branches, posterior superior alveolar branches, posterior superior alveolar, okay, nerves, which are going to supply molar teeth, maxillary molar, upper molar teeth, okay. Then is going to send the zygomatic nerve. This zygomatic nerve is going to split into zygomaticofacial and zygomaticotemporal nerve. If you remember the story of zygomaticotemporal nerve, which is going to carry postganglionic fibers from this ganglion, zygomaticotemporal nerve. Okay. So you have zygomaticotemporal nerve and you have zygomaticofacial nerve. Okay. So this is another branch, the zygomatic branch. Then is going to send greater and lesser palatine nerves through palatine canal, and then this greater and lesser palatine nerves are going to exit through greater and lesser palatine foramen, greater foramen and lesser foramen. So we have greater and lesser palatine nerves going to supply the greater one to the hard palate, the lesser one to the soft palate and the pharynx. Okay, what else? Is going to send orbital, supplying orbital periosteum, Remember, you need to differentiate between the orbital branch and ophthalmic nerve. With the V1, ophthalmic supply eye ball. However, orbital branch of V2 supplies the periosteum, ethmoidal sinuses, and sphenoidal air sinus. So this is the orbital branch, supplies the periosteum and the ethmoidal air sinuses. Okay. Then don't forget that this maxillary nerve also sends pharyngeal branches which are going backward in the base of the skull to go to the pharynx. Pharyngeal branch supplies the pharynx. Also give another branch which is called sphenopalatine nerve going to the nasal cavity. Another branch is called sphenopalatine nerve, which is going through the sphenopalatine foramen and go to the lateral wall of the node, then descend to inside the fossa and come to the oral cavity as nasopalatine nerve. So as you see, several branches, but the continuation is called the infraorbital. Infraorbital inside this groove is going to send middle superior alveolar, supplying premolar, and while it is in this canal is going to send anterior superior alveolar, two incisors, and the canine. So basically, how many alveolar? We have 1, 2, and 3 grooves. The first groove, which behind, is called PSA, or posterior superior alveolar, two molar teeth. Then the second one, middle, coming from infraorbital nerve. The third, anterior, coming from the infraorbital nerve, and they supply upper teeth. Then the terminal branch here, which is infraorbital in the face, is going to divide into 3 branches. One to the lower eyelid, it's called the palpebral. One to the nose, it's called nasal, to the skin over nose. One to the upper lip, we call it labial. And remember, the infraorbital nerve, if you want to do any surgery, on the upper lip, okay, or if you wanted to block the infraorbital nerve, you have intraoral approach. You go through the oral cavity, okay, then from outside here between the teeth and the soft tissue, and then you go, and the lips, then you go upward. Then you have to penetrate the levator anguli oris, or we call it caninus, and through this caninus muscle you reach to canine space. Infraorbital nerve is located in canine space. Okay, this is the intraoral approach of infraorbital nerve block. You go upward, then you inject or you penetrate the caninus muscle, you reach to canine space, then you infiltrate this area, and you reach to the infraorbital nerve. Okay. However, if you wanted to block the PSA, posterior superior alveolar nerve, if you're gonna work on the upper teeth, you can go again touching the maxilla like this until you reach to this area, and you block the PSA. And if you extend the needle more posterior, you can reach to the trigomaxillary fissure, and you block maxillary nerve. Okay, so those are general branches of maxillary nerve, and I will review it again quickly. So maxillary nerve starts from as one of the peripheral branches of trigeminal ganglion, and they exit the skull through foramen rotundum, go to trigopalatine fossa, shift laterally to infratemporal fossa, then continue through the infraorbital fissure, infraorbital groove, infraorbital canal, then infraorbital foramen. Branches, as you see, is going to send posterior superior alveolar branches, zygomatic nerve, which is divided into zygomaticofacial, zygomaticotemporal. Then you have again palatine nerves, the greater and the lesser palatine nerves descend through palatine canal, and through the palatine canal again they are going to exit palatine canal through greater and lesser palatine foramina, and supplying the palate, hard and soft palate. Then you have sphenopalatine nerve, which travels through sphenopalatine foramen in the medial wall of the trigopalatine fossa, and through the nasal cavity is going to descend to incisive fossa. Here is the incisive fossa, if you remember, and from here is called nasopalatine nerve. It continues as nasopalatine nerve, and those are the greater palatine and the lesser palatine foramina. If you remember them, those are the exit of greater and lesser palatine vessels and the nerves. Also there is pharyngeal branch, which come from the trigopalatine fossa backward through this palatovaginal canal or pharyngeal canal, and it comes to the pharynx in this area. Once it go into the orbit, again is ascending orbital branch to supply orbital periosteum and ethmoidal ear sinus. Then the infraorbital nerve give MSA, middle superior alveolar, and anterior superior alveolar, and finally inside the facial area give 3 branches: palpebral to the lower eyelid, nasal to the skin of the nose, and labial to the upper lip. So the importance of maxillary nerve that it is supplying upper teeth, one thing, supply maxillary ear sinus, supplies smoothal ear sinus, supply upper lip, okay, supply lower eyelid, supply palate, hard and soft palate, and nasal cavity. The importance of it also that it is receiving postganglionic fibers from this ganglion, and the preganglionic fibers originally coming from facial through greater superficial petrosal. The postganglionic fibers are distributed through zygomatic nerve to reach to lacrimal gland, or through palatine nerves to reach to palatine gland, or through sphenopalatine nerve to reach to nasal glands. Okay, so there is connection between the maxillary nerve and the sphenopalatine ganglion through those two ganglionic branches. Sometimes we link the sphenopalatine nerve, palatine nerve, and several other branches to the ganglion, because actually the sensory root of the ganglion, which coming from V2, travel through the ganglion without a stop. So basically those branches considered also as branches from the ganglion. Thank you.